Which of the following best defines total anomalous pulmonary venous return, TAPVR? A. Pulmonary veins drain into the left atrium via a stenotic vessel. B. All four pulmonary veins fail to connect to the left atrium and instead drain into the systemic venous circulation. C. Only the right pulmonary veins drain into the superior vena cava. D. The pulmonary artery arises from the left ventricle. Answer, B. All four pulmonary veins fail to connect to the left atrium and instead drain into the systemic venous circulation. What is the most common physiological consequence of TAPVR in the absence of an atrial septal defect, ASD? A. Left-sided heart failure. B. Systematic hypertension. C. Incompatibility with life. D. Isolated pulmonary valve stenosis. Answer, C. Incompatibility with life. In the Darling classification of TAPVR, which type involves the pulmonary veins draining into the coronary sinus or the right atrium directly? A. Type 1, supracardiac. B. Type 2, cardiac. C. Type 3, infracardiac. D. Type 4, mixed. Answer, B. Type 2, cardiac. Which type of TAPVR is most frequently associated with severe obstruction and early neonatal respiratory distress? A. Supracardiac. B. Cardiac. C. Infracardiac, infradiaphragmatic. D. Mixed. Answer, C. Infracardiac, infradiaphragmatic. The snowman or figure of 8 appearance on a chest X-ray is classic for which type of TAPVR? A. Supracardiac. B. Infracardiac. C. Cardiac. D. Type 4. Answer, A. Supracardiac. In supracardiac TAPVR, the pulmonary veins typically collect into a common vein that drains into which vessel? A. Inferior vena cava. B. Left innominate, brachiocephalic, vein. C. Hepatic vein. D. Azygous vein. Answer, B. Left innominate, brachiocephalic, vein. Which of the following is a consistent finding on an EKG of a patient with TAPVR? A. Left axis deviation. B. Right ventricular hypertrophy. C. Left bundle branch block. D. Delta waves. Answer, B. Right ventricular hypertrophy. Why is a right-to-left shunt at the atrial level necessary in TAPVR? A. To decrease pulmonary blood flow. B. To allow oxygenated blood to reach the systemic circulation. C. To prevent the development of a patent ductus arteriosus. D. To equalize pressure in the pulmonary arteries. Answer, B. To allow oxygenated blood to reach the systemic circulation. Physical examination of a neonate with non-obstructive TAPVR typically reveals A. A loud, single S2 and a systolic ejection murmur at the left upper sternal border. B. Absent peripheral pulses. C. A continuous machinery murmur. D. Severe systemic hypertension. Answer, A. A loud, single S2 and a systolic ejection murmur at the left upper sternal border. What is the definitive treatment for TAPVR? A. Chronic administration of prostaglandin E1. B. Balloon atrial septostomy, Rashkind procedure, as a permanent cure. C. Surgical redirection of pulmonary venous return to the left atrium. D. Heart-lung transplant in all cases. Answer, C. Surgical redirection of pulmonary venous return to the left atrium. Infracardiac TAPVR often involves the common pulmonary vein passing through the diaphragm via the A. Aortic hiatus. B. Esophageal hiatus. C. Foramen cecum. D. Caval opening. Answer, B. Esophageal hiatus. Which of the following conditions is frequently associated with TAPVR, particularly the mixed type? A. Down syndrome. B. Heterotaxy syndrome, asplenia/polysplenia. C. Marfan syndrome. D. Turner syndrome. Answer, B. Heterotaxy syndrome, asplenia/polysplenia. A hyperoxic test, giving 100% oxygen, in a neonate with obstructed TAPVR will typically result in A. A significant rise in PaO2 above 150 mm of mercury. B. Little to no change in POW2. C. Immediate resolution of cyanosis. D. A decrease in heart rate. Answer: B. Little to no change in POW2. What happens to the left atrium in patients with TAPVR prior to surgical repair? A. It becomes severely dilated. B. It is typically small or hypoplastic due to lack of direct pulmonary venous inflow. C. It develops thick, muscular walls. D. It functions as the primary systemic pump. Answer: B. It is typically small or hypoplastic due to lack of direct pulmonary venous inflow. Postoperative pulmonary vein stenosis is a known complication following TAPVR repair. What is the primary clinical sign of this? A. Recurrent cyanosis and pulmonary hypertension. B. Systemic hypotension. C. Sudden onset of bradycardia. D. Improved exercise tolerance. Answer: A. Recurrent cyanosis and pulmonary hypertension.